Good day everyone, I am Katrina Aline Cardera from BSN 12 Section F, and today I will be performing my return demonstration about parenteral drug administration, particularly the intramuscular injection. That is a technique that used to deliver medication through the deep large muscle. The first thing that we're gonna do is to check for the MAR. So this is to make sure that the right medication is being given to the right client. Next is to carefully check the medication and compare it to the MAR to make sure that the right medication is being prepared and given to the client. Next is follow the 3 checks for administration. So first is to read the label on the medication when it is taken from the medication cart, and before withdrawing the medication, and lastly after withdrawing the medication. And next is it is also important to organize our equipment. So as you can see here, I have already prepared all my equipment, so this is to conserve time and energy. Now, preparing medication from ampules. Perform hand hygiene and observe other infection prevention measures. This is to deter the spread of microorganisms and to protect our client from any source of bacterial infection. Now, let's prepare the medication ampule to drug withdrawal. First is flex the upper stem of the ampule several times with fingernail. Next is use an ampule opener or place a sterile gauze between your thumb and the ampule neck or around the ampule neck and break off the top by bending it toward you to ensure that the ampule is broken away from yourself and away from the others. Next is place the antiseptic white packet over the top of the ampule before breaking off the top, and dispose the top of the ampule in the sharp container. Now, withdraw medication. Place the ampule on a flat surface. So as you can see here, the ampule is on the flat surface. Next is attach the filter needle to the syringe. So as you can see, the needle is already attached to the syringe. Now, remove the cap from the filter needle and insert the needle into the center of the ampule. And it is important not to touch the rim of the ampule with the needle tip or shaft. And with a single dose ampule, hold the ampule slightly on its side, and if necessary, to obtain more than ordered amount of medication. Dispose of the filter needle by placing it in a sharp container. Now, if giving an injection, replace the filter needle with a regular needle and tighten the cap of the hub and push the solution into the needle to the prescribed amount. Then, discard. Then, cap again the needle. Now, perform again hand hygiene and observe other appropriate infection prevention measures. And this is to make sure that we can prevent ourselves and our client from any spread of pathogenic microorganisms. Now, as you can see, the medication is already prepared, and we need to inject it to the client. Now, provide our patient privacy, and this is to enhance or to make our client comfortable all throughout the procedure. So now I will be closing the door. Now, it is also important to prepare our client and to inform our client what will be going to happen, and this is to enhance rapport and make sure that our client know what will be done to her. So prior to performing the procedure, introduce self and verify the client's identity using agency protocol. So good morning, ma'am. I'm Katrina Aline Cardera, your student nurse for today. And may I see your wristband, please? Can you please state your complete name? today, ma'am, I will be performing intradermal injection, which means I need to intramuscular injection rather, which means I need to inject it into your ventogluteal site, and because this is a technique used to deliver medication through the deep large muscle. Will that be alright? Okay. So now assist the client in a prone position because appropriate positioning promotes relaxation of the target muscle. So ma'am, may request you to position, alright. Also, it is important to explain what medication will be given to the client because this will help her to know what medication will be given to her. So, ma'am, I will be injecting penicillin into your skin and this will help you to treat your bacterial infection. Will that be alright?
Yes.
Okay. Now, it is also important to select a site free of skin lesion, tenderness, swelling, hardness, or localized inflammation, and one that has not been used frequently. And if injections are to be frequent, it is important to alternate sites, and it is also important to avoid using the same site twice in a row. So as you can see, I've already located the site where I will going to inject my client. Now I will be going to apply clean gloves, and this is to prevent transmission of infections through Now, clean the site with an antiseptic using circular motion. Now, I will be cleaning the site using circular motion. Then, discard. Now, I will be going to prepare the syringe for injection. So, now I will be going to remove the cap of the syringe while waiting for the antiseptic to dry. And now, I will be going to inject the medication using the Z-track method. And holding the syringe between the thumb and forefinger as if holding a pen, pierce the skin quickly and smoothly at a 90-degree angle. Hold the barrel of the syringe steady with your dominant hand and aspirate by pulling back on the plunger with your dominant hand and aspirate for 5 to 10 seconds. If blood appears in the syringe, withdraw the needle, discard the syringe, and prepare a new injection. And if the blood does not appear, inject the medication steadily and slowly, approximately 10 to... If blood does not appear, inject the medication steadily and slowly while holding the syringe steadily and using the ventrogluteal site. Now, after injection, wait 10 seconds if using the ventrogluteal site. After injecting our client, it is important to withdraw the needle smoothly at the same angle of the insertion. Then, apply gentle pressure at the side with a dry sponge or cotton balls. And it is not necessary to massage the area at the site of injection. Then, we need to discard our injection. And if bleeding occurs, apply pressure with a dry sterile gauze until it stops. Now, activate the needle safely, device or discard and uncap the needle and attach the syringe into the proper receptacle. So as you can see, I have already discarded my injection into the proper receptacle. Now, remove and discard the gloves and perform hand hygiene. And this is to deter the spread of pathogenic microorganisms. Lastly, it is also important to document all relevant information, the time of administration, the drug name, the dose, the route, and the client's reaction. Because this will help us to make sure that the medication is given to our client, and also it will save us our baseline And that will be all with my return demonstration.